The stethoscope bell emphasizes low-pitched sounds such as the normal heart sounds. The diaphragm is better for higher-pitched sounds. At each site, identify the first and second heart sounds. Assess their character and intensity. Note any splitting of the second heart sound. Feel the carotid pulse with your thumb to time any murmur. Concentrate in turn on systole and diastole. Listen for added sounds and then for murmurs. Soft diastolic murmurs are sometimes no more than a so-called absence of silence. Listen to the precordium systematically with the bell and then the diaphragm. Listen at the apex where you felt the apex beat. This is a good site to hear mitral murmurs. The lower left sternal border is the best place to hear the murmur of a VSD. The upper left sternal border is the best place to hear pulmonary valve murmurs, and the upper right sternal border is a good place to hear the murmur of aortic stenosis.
Please take a breath in and hold. Breathe normally.
Listen over the carotids with the diaphragm. You may hear the radiation of an aortic stenosis murmur or carotid bruits. Listen in the left axilla with the diaphragm. The pansystolic murmur of mitral regurgitation, often described as loud and blowing, can radiate here. Next, listen specifically for mitral stenosis with the bell at the apex.
Please could you roll onto your left-hand side?
This is accentuated in the left lateral position. It's a mid-diastolic rumbling sound which may follow an opening snap.
Please could you sit forward for me?
With the patient leaning forward, listen in held expiration.
Take a deep breath in and out and hold.
For the murmur of aortic regurgitation, best heard at the left sternal edge in the third or fourth intercostal space. Listen over both lung bases posteriorly with the bell for the crackles of pulmonary edema.
And in and out.
Examine for superficial edema over the sacrum, a common location when patients are bedbound. Use 2 fingers, press gently for a few seconds, and see if this leaves an indentation.
Please lie yourself flat.